Okay, so when your gums bleed, when you brush or floss, that's not normal. It's a warning sign. And bleeding gums are one of the first signs of gum disease. And if that's left untreated, that can slowly increase the risk of tooth loss and even serious health problems. And studies show that people with gum disease are up to 3 times more likely to develop heart disease. And it's also been linked to a higher risk of strokes and diabetes. But the good news is you can stop it before it gets worse. Let's break it down. So why are your gums bleeding? I would think of your gums as like a foundation for a house. If the foundation starts to weaken, cracks start to form. And eventually, everything above is at risk. And that's what actually happens when your gums start to bleed. It's pretty much the first crack. And the most common reason is plaque buildup. So plaque is basically a sticky film of bacteria that forms on your teeth every day whenever you eat or drink something. And if that's not cleaned off properly, that's what causes inflammation and bleeding within the gums. And that's what we call gingivitis, which is the earliest stage of gum disease. But plaque isn't the only thing that can cause your gums to bleed. So for example, brushing too hard. So if you scrub your teeth aggressively, that doesn't actually make them cleaner. That can actually damage your gums. Flossing inconsistently. So if your gums bleed when you floss, it's not a sign to stop. It's a sign to continue. Vitamin deficiencies. So being low on vitamin C or vitamin K can make your gums weaker. Smoking and alcohol both slow down healing and dry out your gum tissue. Mouth breathing, because that leads to dryness and that can make inflammation worse. Medical conditions, so diabetes, blood disorders, hormonal changes, they can increase the sensitivity of your gums. So bleeding gums aren't just a mouth problem. They're a full body problem. So here's what happens when you ignore it. So your gums start to pull away from the teeth. So this ends up creating pockets, and that's where bacteria can thrive. Your teeth can lose support. So over time, they can loosen and eventually fall out. Bacteria in your bloodstream. So studies show that there's an increased risk of heart disease, strokes, and diabetes, bad breath, and chronic infection. So a constant bad breath or smell can actually be a sign of a deeper infection. Most people don't realize how fast this can happen. So from week 1 to week 2, gums start bleeding when you're brushing or flossing. And then from month 1 to month 3, swelling can increase, gums can look irritated and inflamed. And then after 6 months, gums can start receding and they end up exposing more of the tooth. And then 1 year plus, if nothing is being done, you're not cleaning properly, you're not regularly seeing your dentist, sometimes deep pockets can end up forming, and then that's what can lead to a severe infection and a possible tooth loss. But the good news is you can stop this before it gets worse. So here's what actually works. So as a daily oral care routine, here's what I suggest. So brushing twice a day with a fluoride toothpaste. So make sure you use a soft bristle toothbrush and brush in small, gentle, circular motions, not back and forth scrubbing. Spit, but don't rinse immediately. So leave the toothpaste for at least 30 minutes to sit on your teeth. Floss every day. So if your gums bleed when you floss, you might be tempted to stop, just like you would with any other part of your body. But don't do that with your teeth. Continue flossing. So it's a sign that you should continue flossing. Use an antibacterial mouthwash. So rinse with a chlorhexidine mouthwash, hydrogen peroxide, or even warm salt water. But make sure you don't rinse after you brush. Rinse at a different time of day. And make sure you stay hydrated because a dry mouth can make bacteria grow faster, increasing plaque buildup. Cut back on sugar. So less sugar means less plaque buildup, which means less inflammation. Quit smoking because smoking reduces the blood flow to the gums, it slows down healing, and increases the risk of gum disease. Also try a water flosser. It's a gentler way of cleaning in between your teeth if you find flossing using interdental brushes hard. And make sure to visit your dentist regularly, especially if you're pregnant or have type 2 diabetes, because you're at a higher risk of developing gum disease. So here's what you should avoid. So make sure you don't use a mouthwash straight after brushing because that washes away the fluoride protection. So if needed, make sure you use a mouthwash at a different time of day. And make sure you don't smoke or stop smoking because smoking damages gums, it stains teeth and increases the risk of oral cancer. And the key here is consistency. If you stick to these habits daily, you'll see improvement in a few weeks' time. Here's when you should be seeing a dentist. Now, if your gums bleed, still after 2 weeks of trying, book an appointment. And here's some other signs to look out for. So if you have swollen, puffy gums that don't improve, receding gums, so teeth that end up looking longer than before, that's a sign of receding gums. Or even chronic bad breath that doesn't go away, loose teeth or gum pain, pus or abscesses along the gum line. So here's what to expect when you come see a dentist. So pocket measurements. So what we do is we check how deep the bacteria have settled, possibly a deep cleaning. So we remove the hardened plaque that's under the gum line, and a possible antibiotic treatment, especially if the gum disease is severe. So bleeding gums aren't something you should ignore. If you catch it early, you can reverse the damage. So make sure you brush gently, floss daily, and don't wait too long before you see a dentist.